Hey Moonbeams, thank you so much for visiting my channel. I appreciate you for being here. Make sure you like, follow, and subscribe so that we will remain connected. I am officially 2 weeks away from the first of my two total hip replacements. They're starting with my right hip, and yes, the surgery is on a Saturday. Today I'm beginning the big deep clean of my bedroom. I'm gonna pull everything out and, clean the woodwork, the wall, the floor, everything, because for those of us who are immunocompromised, the risk of infection is very high for us. So we have to do any and everything possible to lower those odds for us, because infection takes a lot of us who are immunocompromised out of here. So we have to do our due diligence and make sure we're coming back into a clean space with these open wounds. And not just the fact that our bodies have been cut open, but we're still healing. And because our immune system is compromised and doesn't work effectively, it can't fight off the invaders, the colds, the viruses, the bacteria, the germs, bugs, all that kind of stuff. So we have to be extra cautious when it comes to our care. So although it's going to take a lot of my energy, and I've been struggling with high pain lately, my hip and my thigh was on fire the past couple of days. So much so where I've been literally limping from the pain and discomfort. So I'm starting early now so I can do it in phases and stages and not be bombarded doing all of it at one time, because my physical ability just won't allow me to do it all at one time anyway. Work smarter, not harder. We autoimmune warriors definitely need to adopt that motto. Although I know that my total hip, they're taking out the hip, the ball and joint socket, and my femur, and replacing it with the, I guess, titanium. I really don't know. I meet with the surgical scheduler on Tuesday to finalize everything, sign my life away and get everything finalized so they're all set and prepared for the procedure on the 18th. And once I get through that visit, I will be able to ask the specific questions that I have, which what type of metal are you replacing my leg with, my bone with, how bones, how long should I expect to be down, because this is an outpatient procedure. I just don't understand that, for one. They say it's an outpatient procedure and I'm going to come home right after, but I have taken it upon myself to contact my insurance provider to see about a rehab facility, a skilled nursing facility to go to after I have this procedure, because I just don't understand how they send somebody home after such an invasive procedure. But one thing that they said was they considered this as, and the insurance deems this as an elective surgery, which is crazy to me when my bones and joints are literally deteriorating. So how is this an elective surgery? Nevertheless, this is happening. I'm 2 weeks out. I'll have more answers for that I have questions to or about, and I will start doing further research and looking into the procedure online on YouTube. People who've had the procedure done, or a doctor who posted about it. I haven't allowed myself to look at it because I don't want to freak myself out. I don't want to give myself anxiety too soon, because I can have anxiety. So I've been really cautious not to pay attention or look up, Google anything. The most that I've done was I've spoken to a fellow lupus warrior, shout out to Judith, to ask her about her replacement. She had both of her hips replaced years ago. And she said they kept her in the hospital for at least 3 days. Then she went to rehab. So clearly a lot has changed, and it has everything to do with the insurance system, company, corporation, business, however you want to address it. I ain't mad at Luigi. Take that however way you want, because this is not right. I am immunocompromised, and the surgeon for the spine, for my cervical spine, he said he doesn't even want to do the surgery because he doesn't feel I'm a good candidate for recovery. So how can, and that's because of all of the autoimmune diagnoses that I have and other health issues that I have. But for them to do the hip and expect it to be just for me to be able to go home, I don't want to guarantee anything, and I definitely don't want to speak anything into existence, but I don't see me coming home right after a surgery of that magnitude. I just don't see it. Anyway, have any of you guys experienced this? I would love to hear your input, especially if you are immunocompromised and have autoimmune diagnoses. The doctor said the reason my hips have deteriorated is specifically due to Sjogren's syndrome, which is my primary autoimmune diagnosis. It's not lupus. Lupus is my secondary diagnosis. Sjogren's is my first, and Sjogren's is eating my ass up. That causes the tooth loss and the poor vision and the joint pain and all that stuff. That's more associated with my Sjogren's diagnosis. So here it is, guys. Let the countdown begin. Peace, love, and blessings. Luna out.